My name is Dr. Marty Kotler. I want to thank you for attending this webinar on the 2026 Billing, Coding, and Compliance Updates. Just a quick disclaimer before we get going. The information in this webinar is for educational purposes. It's not intended to substitute your thorough clinical decision making. It's not intended to substitute your billing protocols. It's not intended to be legal advice. Target Coding does not provide legal services. CPT is a registered trademark of the AMA, and every attempt has been made to make certain that the information in this webinar is 100% accurate. However, it's not guaranteed. We have a lot of people listening to this webinar today. Some of you are past attendees of our webinars and seminars. Some of you are members of Target Coding, and some of you are brand new to my company. So for those of you that have no idea who I am, let me tell you a little bit about myself. Again, my name is Dr. Marty Kotler. I am a chiropractor. I practiced for 16 years prior to starting my company, Target Coding. I am also a certified professional compliance officer and certified billing and coding specialist. My area of expertise is in coding, billing, cash practice compliance, durable medical equipment, documentation, risk management, record keeping, Medicare, and HIPAA. And I consider myself kind of unique. Most doctors are not certified coders. Most certified coders are not doctors. So you'll see during this webinar how I combine both specialties to help you improve productivity, maximize reimbursement, reduce administrative burden, and show you how to get paid for everything you do. Target Coding has been helping thousands of doctors and their staff members for over 15 years with our exceptional products and services. Now, those of you that are members of Target Coding, you can get the playback recording sent to you. All you need to do is log into your account, and assuming this recording comes out clear and nice, within 24 hours, we're going to put the playback recording and the PowerPoint slides in your account. It'll be waiting for you once you log into your account. Also available for Target Coding members is a certificate of attendance. If you look at your monitor, that's what a certificate of attendance looks like. And we recommend you place your certificate of attendance in your billing and coding policy manual. If you don't have one, you should have one, just in case the coding police come knocking on your door. You can use the certificate of attendance as proof that you take billing and coding seriously and you care about preventing fraud and abuse. Any questions so far? Email info@targetcoding.com, and one of our staff members will get back to you right away. Okay, let's begin the 2026 Billing, Coding, and Compliance Updates. Let's begin with patient financial forms. Forms are so important. When patients come into your office, one of the most important things and one of the first things patients do is fill out forms. These forms can help prevent malpractice, can help prevent patient upsets, and help you get paid properly. So here are a few forms: new patient forms, HIPAA forms. There's a whole bunch of forms. I'm going to focus on a couple of forms right now. And by the way, now is a good time to do a complete scrubbing of all your forms once a year. Take a look at all your forms, see if you need updating, and I'm going to show you what should get updated in a few minutes. So let's talk about your HIPAA form. Your HIPAA notice should be somewhere posted in your waiting room. Maybe you want to put one in a frame and put it on the wall in your waiting room. Maybe you want to laminate one and put it on the coffee table in your waiting room. Many of the doctors we work with have a television monitor that loops chiropractic messages. You could have it scrolling across the screen. You can give everyone a copy of the form. Now, you have to have a form that the patient acknowledges that you gave them the opportunity to get a copy, or you can give everyone a copy. So here again, just look at your forms, make sure they are appropriate, make sure it talks about how you're going to share patients' information. Why is it important to share patients' information? You got it. In order to get paid, you're going to be sharing information with insurance companies. And if you're not a insurance practice, if you're a cash practice, you're going to be sharing patients with other attorneys and other healthcare providers. I was reviewing a level 3 members of Target Coding get a complete forms scrubbing. So I was looking at a doctor's HIPAA form, and it said there was a lot of dental information in this doctor's HIPAA notice. So I contacted the doctor, said, "Where'd you get this form?" He said, "Oh, my brother-in-law is a dentist. He just took his brother-in-law's form. It had all this dental information. It's not good." And if this became an issue where the patient was filing a HIPAA complaint against this doctor, it's going to make this doctor look unprofessional. Also, if you have open therapy rooms or half walls, so you're speaking to patient number 1 and patients 2, 3, and 4 could hear the conversation, put something like this in your HIPAA notice. We make good faith attempts to keep our conversations at a low level. We offer every patient the opportunity to be treated in a private room if requested. Mrs. Smith, are you comfortable being treated in an open room? Now let's move on to one more form. It relates to the No Surprise Act, No Surprise Law, and Good Faith Estimates. Now, good faith estimates is a fancy term for your financial care plans. So the No Surprise Law says it all. You can't surprise patients with a balance due. You have to let them know how much things are going to cost before you provide the services. So this is for your cash patients, out-of-network patients. Even if you're in network and you're going to provide a service like laser, decompression, or shockwave, which is not covered, then the patient should be made aware and sign a form. The form of your estimate has to be within $400 of the actual charges. The patient rights and protections against surprise medical bills is also supposed to be posted in your waiting room somewhere. You could put it right next to your HIPAA notice. And here's a sample good faith estimate. And what we call it in chiropractic are financial care plans. Those of you that are seeing patients for non-covered services, cash practices, you have a financial care plan form. So a couple of things you should add to your financial care plan form. 3 things: your NPI number, your tax ID number, and the diagnosis. Now I know some of you are saying, Dr. Kotler, wait a second. Our financial care plans don't have those 3 things. I don't understand. You know what my response is? I don't understand it either, but I don't make the rules. I just enforce them and explain them. The federal government says on your financial care plan forms, you should have your NPI number, your tax ID number, and the diagnosis. Now, when it comes to cash plans, I'd say about 30% of the doctors we work with are cash practices, and these cash practices are providing excellent services like shockwave, laser, decompression. These services are not covered by most insurance companies, and packages are put together, prepay packages, prompt pay discounts. 24 visits, 12 visits, 36 visits. This is a wonderful way to practice, but just make sure that your prepay plans and your discounts are compliant. I would say 70% of the doctors that show me their financial care plans, they're not compliant. There's these significant discounts that are not in line with standards, and they're violating the dual fee schedule law. So careful. Check with a compliance expert if you offer prepay plans for 12, 24, 36 visits. If you don't have a compliance expert to check your your prepay plans, then contact Target Coding. We do it all the time. By the way, I'm going to be showing you a lot of forms. There's a form right there on your screen. Patient is coming in for shockwave. You can give the patient a statement. We have a whole bunch of sample statements for prepay plans, prompt pay discounts, time of service discounts. If you use Chiro Health USA or other discount medical plan organizations, we have sample statements you can give to patients. For your cash patients that are getting laser, decompression, and shockwave, you may want to give them a 1500 form. So we have a whole bunch of 1500 forms. We have a whole package of forms. If you're interested, let us know. We have a 100 pack of forms, logs, fight back letters, and templates. They all come in Microsoft Word and they're emailed to you instantly, and you just copy and paste them onto your letterhead. Okay, moving along to new ICD-10 codes for this year, new diagnosis codes. There's not that many that relate to chiropractic. I'll show you the ones, and I've scrubbed the updates. There were many, there were hundreds of changes, additions, deletions to ICD-10. However, only a few relate directly to chiropractic. The ones that relate directly to chiropractic relate to pelvic and perineal pain. So yes, you will have patients that come in with pelvic and perineal pain on the right side, on the left side, bilateral. Some patients will complain of suprapubic pain, so there are the codes, R codes. Now, most of the codes you use begin with the letter M or begin with the letter S. So these are R codes. These may or may not be processed properly by insurance companies. So you may want to use them as contributing factors or just put them in your notes. Patients will come in with flank pain. That's not unusual for a patient to come in with flank pain. So we have right side flank pain, left side flank pain, bilateral flank pain, right flank pain, right flank tenderness, left flank tenderness, and suprapubic tenderness. Now, just a little heads up on herniated discs and bulge discs. By the way, I know we have a lot of chiropractic assistants in the billing department listening to this webinar. So let's talk a little bit about the disc. The disc has two components. The center-like portion of the disc is a jelly-like substance called the nucleus pulposus, and the outer rings of the disc are called the annulus fibrosus. So when the nucleus pulposus presses against the annulus fibrosus and presses on the nerve, that's a bulge disc. When the nucleus pulposus goes through the annulus fibrosus and presses on the nerve, that's a herniated disc. Now that's nice. Patients are familiar with these terms, herniated disc, protruded disc, bulge disc. Now, if you look in ICD-10, you're not going to see those terms. Why? I don't know. There are a lot of rules, guidelines, statutes, laws I read all the time. And sometimes I read these laws and rules and guidelines and I just shake my head. And then I shake my head again and go, I don't make these rules, I just explain them. So in ICD-10, you're gonna see the terms disc disorder and disc displacement. In my opinion, you should not be using these terms unless you have an MRI. Whenever I'm reviewing a claim on a client that I'm working with and I see the doctor used disc disorder with myelopathy or disc displacement in the thoracic or lumbar region, I immediately contact the doctor and ask him or her, do you have an MRI? Don't use these unless you have an MRI. Now for the CAs listening to this, I have the descriptions of what myelopathy is. That's cord compression. Radiculopathy is nerve root compression. Now, if you're working with attorneys or you specialize in disc pathology, you may want to add on a couple of codes. There are these add-on codes for defects in the annulus fibrosus. For example, Mrs. Smith comes in with a herniated disc at L3, L4 with radiculopathy. You're going to use M51.16. Now you're reading the MRI report and it shows a large tear or a large defect at that level at L3, L4. Go ahead and add on M51.A2. You always want to code to the highest degree of specificity. That's what the ICD-10 guidelines always talk about, coding to the highest degree of specificity. And then we also have the same logic applies to the lumbosacral region. Mr. Taylor comes in with a herniated disc at L5S1 with radiculopathy. Use M51.17. You're reading the MRI report and it shows a small defect at L5S1. Go ahead and add on M51.A4. Let's move on to CPT codes. Fortunately, there weren't any major changes to the chiropractic-related CPT codes. Now, as you can see, there were 288 new codes, 84 deletions, 46 revisions. None of these relate directly to chiropractic. So that's good news. Now, there are a couple of, I dug deep to see if there's anything that could relate possibly to chiropractic or physical therapy, and I came up with a couple of codes that relate to remote patient monitoring. The two codes you see highlighted in red on your screen, 99470 and 99445, relate to remote patient monitoring. These codes are used to bill for digital collection of data like blood pressure, pulse oximetry, weight from patients without in-person patient visits. Now, while I have you here, a little update on E&M coding. The E&M code documentation requirements come from the American Medical Association. If you've been to my seminars and webinars the past few years, you know how I've gone over the documentation requirements for your new patient codes. 99203, 99204, the most common, and your re-exam codes 99213 and 214. There are documentation requirements that got put out by the AMA a few years ago. Now, these were based on an initiative that the federal government put out. This is the stuff I read, initiatives put out by the federal government. It was called Patience Over Paperwork. That got my attention when I saw that come across my desk. So while I was reading it, I'm noticing a couple of really good things, positive things. Here, this is the initiative, Patience Over Paperwork. 2 items. 1, the purpose of this initiative was to help reduce administrative burden placed on doctors and staff members. Yeah, that's a good thing. And also, it relates to allowing healthcare providers to get paid for every single minute you're with the patient. Yes, that's also a good thing. So the documentation requirements are based on 2 key factors, time or decision making. Hopefully this is a refresher. This should not be new to you. These have been around for a while. And there are the time components for the new patient codes and established patient codes. 99201 and 211 should not be used. Time factor, or most of you are using decision making. How do I know that? Because I spend about a third of my work week doing chart reviews. And when I look at exams and re-exams, I never see the time component. Very rarely do I see the time component. So if you're not using the time as a key factor, you're defaulting to decision making. Hopefully you're familiar with MDM, medical decision making. I like to call it CDM, chiropractic decision making. So get your hands on these guidelines, the E&M guidelines. If you need them, email info@targetcoding.com and we'll send them to you. And they have these wonderful charts that take you through sample clinical vignettes. So for 99203, under the amount of problems, and there are 3 elements when it comes to decision making. Number 1, the amount of problems. In this case, for 203, 2 or more self-limiting problems. Now, I could interpret these for you because this is what I do. I'm an expert in compliance and documentation. When you see 2 or more self-limiting problems, we're talking about Mrs. Anderson is complaining of neck pain and back pain. Beautiful. You're on your way. You're creating that breadcrumb trail for a 203 or a 213. If your notes say, Mr. Johnson is complaining of neck pain, no x-rays taken, you can't bill more than a 202. Now, I always refer to 3 phases of compliant documentation. Phase 1 is the treatment plan. There are 6 components to the treatment plan. And if you look at the photo in the bottom right corner, I relate a treatment plan to the foundation of a house. Look at that house in the bottom right corner. It's crumbling. It doesn't have a good foundation. You want to have a good foundation for your documentation. Start with a good treatment plan. Now, treatment plan is missing in many documentation records. How do I know that? I see it. Plus, Medicare came out with their statistics on the most common documentation errors. Look what they found. Treatment plan insufficient 83% of the time. Wow, that's a lot. Okay, moving along to the 2026 Medicare Part B deductible. The 2026 Medicare Part B deductible is $283. That's a 12% increase. I gave a little timeline since 2020 of the Medicare Part B deductible. Last year, it was $257. And the Medicare fees have increased. Yes, finally, a little bit of an increase on just about every code that Medicare puts out as it relates to physical medicine and rehabilitation. So if you look at the chiropractic adjustment codes, you're probably going to see a little bit of an increase for 98940, 98941, and 98942. If you are a practice that incorporates integrated practice where you bring in a physical therapist, you'll see an increase for therapeutic exercises, neuromuscular reeducation, massage therapy, therapeutic activities. And just a reminder, well, as we're talking about Medicare, there are 2 parts to Medicare that pay for chiropractic. Actually, there are 4 parts to Medicare: A, B, C, and D. A is hospital coverage and D is prescription drug coverage. We're not concerned about those 2. Medicare Part B, those are the patients that come in with that red, white, and blue card. That's an easy one. You see on your screen, John Smith, it says Medical Part B, only spinal manipulation is covered. Now, when it comes to Medicare Advantage plans, also known as Part C, this is where it can get a little complicated. Most of the doctors that I work with are not in network with any Medicare Advantage plan. It's the opposite with Medicare Part B. 99% of the doctors that I work with are seeing Medicare Part B patients enrolled in Medicare Part B, some as par, some as non-par. Medicare Part C, I would say it's the opposite. 99% of the doctors I work with are not enrolled in any Medicare Advantage plan. Now, here's something you should be aware of. This is very important. Even though you're not in network with the Medicare Advantage plan, so you're not in network, you're non-contracted, providers, non-contracted providers with Medicare Advantage plans are required. You're required to accept the original Medicare Part B allowable amount as payment in full. Let me repeat that. Non-contracted providers with Medicare Advantage plans, you're required to accept the amounts allowed as if it was Medicare Part B. Federal law caps reimbursement to non-contracted providers at the original Medicare payment amount plus applicable cost sharing. What's cost sharing? Those are the co-payments, deductibles, co-payments. So, example, Mrs. Williams is coming in, hands you a Medicare Advantage plan. You see, there's an example of what it may look like. Now, at a quick glance, staff members, at a quick glance, this looks like regular United Healthcare. No, it says Medicare 3 times on the card. So this is a United Healthcare Medicare Advantage plan. Now, if you normally bill $70 for 98941, and this Medicare Advantage plan covers spinal manipulation, and they pay, let's say, $40, $20 copay, and they pay you $20 for a total of $40, you have to write off the difference, even though you're not in network. Any questions on that? Email info@targetcoding.com. And this information comes right from the Medicare Managed Care Manual. Those are the manuals I read. The Medicare Benefit Policy Manual, the Medicare Benefit Policy Manual, the Medicare Advantage Plan Policy Manual, the Medicare Integrity Policy Manuals. I read all these manuals. I actually enjoy reading them. You know, we all have strengths and weaknesses. I like reading these guidelines, these updates. I'm sure most of you rather have root canal than read medical policies. I like reading them. I'm a sponge for learning. I don't find billing and coding boring. You could probably tell from the passion in my voice. Okay, now you may have a patient come in with a Cigna Medicare Advantage plan. It's not going to say Cigna on it. HealthSpring, yes. As of January 1st, HealthSpring is the new name for Cigna Medicare Advantage plans. Be aware of that, HealthSpring. Humana. Very few Humana plans are regular commercial plans. Most Humana insurance plans are also Medicare Advantage plans, also known as Part C. Let's switch gears now, talk about modifiers. Just a quick update on modifiers. Here are the most common ones: 25, 59, XS, GP, 97, Q6. And then we have Medicare modifiers: AT, GA, GY, GP. You should be familiar with all of these. Q6 is used for those of you that go on vacation. You all deserve vacations. Yes, take a vacation. If you're going out on leave because you're on vacation, or let's say you have a medical issue and you have a Medicare patient come in, can you hire a chiropractor that does not have a Medicare number to see your patients? The answer is yes, you can. You have to use the Q6 modifier on all the CPT codes. That's all you need to do. 9.7 is used for Humana. Just about every week we get a question at our help desk, Dr. Kotler, why is Humana denying our claim? They're asking for a modifier. We don't know which one to use. It's 9.7. The GA modifier with Medicare means you have a signed ABN form on file, so you never use GA on exams and x-rays and therapies. Now, United Healthcare has an update regarding the GA modifier. This is for regular United Healthcare, not Medicare United Healthcare. GA modifier. United Healthcare requires the GA modifier for non-covered services. GA modifier must be submitted. So if you're in network with United Healthcare and you're about to provide a non-covered service, you're supposed to have the patient sign a form and submit the claim with the GA modifier. So United Healthcare knows what you're doing. There's a link at the bottom of the screen. And here's the form. This is a sample notice to United Healthcare in-network patients. It might be a little bit small on your screen to see it, but this is the form you should be using. If anybody would like a copy of this form, email info@targetcoding.com. Now, for those of you that have integrated practices with a physical therapist on board, you should be familiar with the KX modifier. It's called the KX modifier threshold. So for coverage year 2026, the KX modifier threshold is $2,480. $2,480, that's for physical therapy and speech language pathology combined. Now, the targeted medical review threshold dollar amount is $3,000. Any questions on the KX modifier threshold? Email info@targetcoding.com. Let's switch gears now and talk about HIPAA compliance. There's been an update for this year regarding business associates, but a little basic information about HIPAA. Actually, what does it stand for? The Health Insurance Portability and Accountability Act. It became a law a long time ago, almost 30 years ago. The main purpose of HIPAA is to protect patient health information, also known as PHI. You're all covered entities. I'm assuming you are all covered entities. Covered entities must abide by HIPAA. Now, I'm not going to get into too many details on HIPAA. I'm going straight to business associates. So doctors, staff members, do you have business associates? You probably do. You might not even know that you do, but you probably do. So Dr. Kotler, what is a business associate? A business associate is any person or organization that has access to your patient information, but they're not an employee. Classic example, a billing company, software company here. There's a whole bunch of examples here, a clearinghouse, DME and back brace companies, certain attorneys, your IT consultant, collection agencies, transcription services. These are all people or organizations that can see your patient private health information, but they're not an employee. So, do you have business associates? Probably. So, business associates need to abide by HIPAA, just like healthcare providers do, with certain limitations. So, this is new. You should be asking your business associates. So, for example, let's say you have a billing company that works for you. These are the questions you should ask your billing company because they are a business associate. Ask your billing company, do you have a HIPAA security officer? Yes, you do. Has your HIPAA security officer gone through formal HIPAA training? Has the billing company gone through a security risk assessment in the past year? Does the billing company have HIPAA policies and procedures? Has the billing company, if the billing company has employees, have the employees been trained on the HIPAA policies? Does your billing company use encryption to protect electronic PHI? Does your billing company have documented backup plan? It's all required. Let's switch gears a little bit as it relates a little bit to HIPAA. Online reviews. Many of you have good, positive online reviews. Some of you have negative reviews online. So, how do you deal with negative reviews? Number one, avoid confirming patient status. Never confirm or deny that the reviewer is a patient. That could violate HIPAA. Instead, use neutral language such as, "We appreciate your feedback and strive to provide excellent care to everyone who visits our clinic." Stay general or else you'll violate HIPAA. Example, "We aim to ensure a positive experience for all and welcome opportunities to improve our services." Encourage direct contact. Example, "We'd like to learn more about your concerns. Please contact our office directly so we could address them appropriately." If you don't have a HIPAA compliance manual with policies and procedures, and you have the time to create one on your own, start with this website. This is an excellent link for HIPAA for healthcare professionals. Now, I would say most of you do not have the time to create your own HIPAA manual, so contact a company like Target Coding. That's one of the things we do, is we create HIPAA policies and procedures. We do it all the time. We've done it for over 300 offices nationwide. Also, as part of HIPAA, you should be conducting a security risk assessment. Here again, if you have the time to do it on your own, start with this website. It's an excellent security risk assessment tool. If you don't have the time to do it, contact us. Happy to help you. Now, a couple of things about Shockwave. Shockwave has become a very popular modality. I would say 60% of the doctors we work now have incorporated Shockwave. Now, there are a lot of things when it comes to Shockwave. If you check out my YouTube channel, I have a free video on Shockwave fees, equipment, clinical indications, contraindications. Now, I'm going to address a couple of things today, and that is regarding Shockwave training. Doctors, make sure you are trained appropriately by the company you purchased the Shockwave unit from. Doctor training will be different than staff training. Document your trainings. Get certificates. Get certificates of attendance, like I mentioned earlier for this webinar. Get certificates of training and put those in your policy manual. Take CEU courses in Shockwave therapy. Verify coverage if you're going to be billing for Shockwave. Some insurance companies do cover Shockwave. It may be limited to certain conditions. So yes, some companies do cover Shockwave. That's why you should not automatically tell every single patient that comes into your office, "We're going to be doing Shockwave. It's not covered by your insurance." Check. There may be a situation where it is covered for certain conditions like plantar fasciitis. A little bit about Shockwave documentation. By the way, the code for Shockwave now, some people call it or have units that are called SoftWave, Shockwave, StemWave, HydroWave. It's all different terms, but they all use the same billing code. It's a Category 3 temporary code. It's 0101T. Your documentation should state, is it radial shockwave, focus shockwave, combination of both? Is the patient in the supine position? The anatomic site? Are they in the prone position? The amount of time you're doing the shockwave? The amount of shocks, pulses, intensity, frequency? Did the patient tolerate the treatment well? How often are you doing shockwave? You may be seeing a patient 3 times a week for chiropractic, but they're only getting Shockwave 1 time per week. And there are contraindications you should be aware of. Is Shockwave decreasing inflammation or increasing inflammation? There are instances where Shockwave increases inflammation, but the doctor's notes are saying it decreases inflammation. And that doesn't make sense. Here's a sample Shockwave soap note. It's a little bit small on your screen. If anybody would like a copy of Target Coatings sample Shockwave soap note, send an email to info@targetcoating.com. All right, we're rounding third. Just a few closing comments. Prevention is the key. I'd rather deal with a doctor who is looking to prevent problems than a doctor that's in the middle of a huge audit. 80% of the doctors we work with us to prevent problems. 20 are in a crisis. I just had to speak to an attorney this morning about a chiropractor that's being audited for $225,000. It's not fun. So what are the best ways to prevent problems? Have policies and procedures on billing and coding and documentation, specifically on how do you train your employees on billing and coding? What's your policy on prepays, cash plans, discounts? What about deductibles, co-pays, co-insurance? Some of the doctors I speak to, they want to be nice guys. This is what I've heard. Dr. Kotler, we have a patient coming in with a $500 deductible. This patient has committed to a 36-visit care plan. So I'm going to waive the deductible because I want to be a nice guy. This patient's going to be coming in 36 times. We're going to eat up that deductible. Yum, yum, eat up the deductible really quick. So I'm not going to collect it because I just want to be a nice guy. You know, investigators don't look at this as being a nice guy. This is how an investigator looks at it. You took $500 cash, you put it in an envelope, and you handed it to the patient on the first visit. What's that? That's a kickback. And what does that do? That violates the anti-kickback statute. Careful with that. You should have a policy on doing background checks on all of your employees that have anything to do with billing and coding. Have a policy on documentation. When do you document? You should be documenting the encounter on the day the service is rendered, but there are exceptions. That's part of our billing and coding policy manual. Now, this is what you don't want to get. This doctor's was audited by Cigna, needs to send back $250,000. This doctor's on a prepayment audit, which is good news and bad news. We helped this doctor. This doctor had to send in notes. Insurance company said, good news is we're not going to ask you for any back right now. Bad news is we're putting you on a prepayment audit. Now, there are situations where you're going to get a letter back from an insurance company with good news. We've had many doctors get good news. Here's a sample. We worked with a doctor from South Carolina, got audited by Blue Cross Blue Shield of South Carolina. We helped him with his notes, and he got this letter back. It says a review of the records you provided determined that they meet the requirements. This audit is being closed. No further action. Great news. Here's another doctor. We helped this doctor. She has a very busy practice. She sees about 80 patients a day. She was requested to send in her notes. We helped her, and she gets this letter back. It says, the last sentence of the second paragraph, it says, we applaud you on your billing accuracy, and we encourage you to continue your current billing practices. So my strong recommendation is put together a billing and coding policy and procedure manual. We can help you do it. It doesn't take that long. It'll help prevent whistleblower action from your employees. This is a book that I wrote on the best codes to improve reimbursement. In my opinion, it should be part of every chiropractic billing and coding library. It has 3 chapters. Chapter 1 gives you the codes that pay for the most visits, like sciatica, herniated discs, numbness, cervical radiculopathy. And I also provide you the short-term treatment diagnosis codes, like muscle spasm. You get these cheat sheets. It's broken down by anatomic site. Section 2, I show you how to pair your codes. You should be pairing your codes. You know, your CPT codes are what you're doing. Your diagnosis codes are why you're doing what you're doing, and they should pair like food and wine, like peanut butter and chocolate. Example, myofascial release, 97140, pairs beautifully with myofascial pain syndrome in the neck. That's M79.12. Here's another one. In section 3, I put on my clinical hat. I had a few chiropractic gurus when it comes to clinical approaches help me with this section. So I put together 25 of the most common chiropractic diagnosis codes and a checklist, the subjective findings, the orthopedic findings, the neurological findings, and the chiropractic findings. You also get a spreadsheet that helps you prevent the excludes one denials. For example, if you bill for low back pain, don't also bill for strained low back muscles on the same claim. There's a whole bunch of these combinations that you should avoid. So this book will help reduce administrative burden. It has the best PI cheat sheets in the industry. If you have staff meetings, use a page out of this book. Use it as the topic of the day. It'll help you get paid better and faster. So we do a bunch of live seminars. We do webinars. We have on demand. If you go to Target Coding, you could see our library of 25 on-demand classes. They're all up to date, new, present information. Check it out. We also have CA boot camps. We call that our CATS series, Chiropractic Assistant Training Series. 6 one-hour courses. They're all approved for CEUs in many states. Great for brand new CAs, even seasoned CAs love these trainings. We offer memberships, 4 levels of membership. Level 1 is only $99 a month and you pay as you go. You don't want to become a member? You want to work with me on an hourly basis? You could pick my brain for an hour. We offer pay-by-hour services, personal coaching to address your specific situations. We also, I mentioned our forms, logs, letters, fight back letters, templates, letters of medical necessity. You get all of our ABN forms. You get all of our HIPAA forms, all of the financial policy forms I was referring to earlier. This is our HIPAA manual. Chart reviews. We do a lot of things at Target Coding. You might not have been aware of all these things. We do credentialing. We do 14 different products and services, videos on decompression, neuropathy, laser, shockwave, HIPAA, Medicare, post-payment audits, chart reviews, nurse practitioner integration programs. We offer a lot of services. We have tons of testimonials across the country. We have options to fit every practice. Please check with all the carriers you bill prior to submitting claims to ensure it's compliant. Target Coding does not guarantee this information will guarantee payment from any insurance company or patient. Target Coding is not responsible for any laws or rules that may change following this webinar. Things change all the time. So it's important to do your best to stay on top of these changes by attending seminars and webinars and joining your national and state professional associations. We have a webinar coming up on January 22nd, 6 CEUs. It's from 8 a.m. to 2 p.m. Eastern Time. 6 CEUs in over 30 states have been approved. Follow us on Facebook, Instagram, LinkedIn, YouTube for the latest on billing and coding. My contact information, info@targetcoding.com, website targetcoding.com. Telephone number 1-800-270-7044. Yes, we still have doctors that would like to fax us information, so we have a HIPAA secure fax number, 1-844-831-2347. For those of you that would like to set up a consultation with me, no charge consultation, you can scan that QR code in the bottom right corner, or you can give us a call or send us an email. I'm happy to do it. So again, I want to thank everyone for attending. I hope you learned a lot. Take care, everyone. Bye-bye.